Minimally invasive spine surgery is basically decompressing or fusing or taking pressure off of nerves or the spinal cord in the least damaging way possible. I'm Dr. Berger. I'm a complex spine fellowship trained neurosurgeon running the minimally invasive complex spine program. We want to cause as little collateral tissue damage as possible to get down to the pathology and safely remove whatever is offending the nerves or the spinal cord. A good candidate for minimally invasive spine surgery would be somebody who has one or at most two fairly straightforward problems in their spine on their MRI or their CAT scans. And once we have a firm diagnosis on what's causing the problem, then we can get a small tube to get down to the lumbar spine or the cervical spine and decompress or even fuse the spine at that level. There are many latest advancements in spine. Spine is always evolving. The thing that has been helping a lot of patients lately is artificial cervical discs and now artificial lumbar discs that are viable options for maintaining range of motion and reducing post-op pain after somebody has their neck or their lumbar spine decompressed. It allows the patient to continue motion at that level, and because they're able to have their normal motion, they can find their own position of comfort. We always take a good look at a CAT scan and an MRI before deciding to place an artificial disc in someone. Candidates for lumbar artificial disc are people who have basically one bad lumbar degenerated disc. It's patients who have normal looking facet joints, and the facet joints are the joints in the back of the lumbar spine that you exert when you lean backwards. If you don't hurt when you lean back, but you hurt more when you bend forward, that suggests that the disc itself is the damaged problem and not part of your facet joint. If your facet joints are damaged, you would probably either need a decompression or a fusion. Good candidates for cervical artificial discs are people, again, who have normal looking facet joints in the back of the neck, but a bad disc or a herniated disc pushing up against the spinal cord or against the nerves. But we don't want to go in there and fuse them necessarily. We'd like to let them maintain their range of motion. We preferentially perform minimally invasive spine surgery because we're a small hospital and we can stay more focused on the less invasive, more straightforward spine procedures and have a better consistent outcome. And patients on the windward side, they want to get back to their family so that their family can take care of them at home. Patients typically are here either 1 day or 2 days after surgery and then they go home. Most patients have a really high satisfaction with the post-op care that they have here at our hospital.
This segment is sponsored by Adventist Health Castle. For more information, visit HighNowDaily.com.